Welcome, Marlene Roberts, to the Vagina Doctor podcast.
Thank you. It's a pleasure to be here.
It's great to see you again after a few decades since we last. We never really worked together.
No.
You were a patient, actually.
Until now.
Yes. I was a patient.
Yeah.
And I tried to introduce you to bioidentical hormones about, 15 years ago, 10 years ago.
No, it wasn't that recent because I was doing it in 2020.
Oh, were you?
Yeah.
Okay.
So, not 2020, in 2002.
Oh, early.
Yeah.
Okay.
But you were ahead of me.
Oh.
I think you started earlier than I did. But tell me your history. Tell me your history.
So how I got into this at all was because I went to the conference for the American Academy of Anti-Aging Physicians, and I learned about the hormones and using pellets and the success rate with pellets. I learned a lot about testosterone and the need for it in women. I didn't realize that before. So I decided to do their fellowship. I started their fellowship. And then I went back to school and got my NP license. And this was in 2018. I got licensed. From the get-go, I've been doing bioidentical hormones. Right now, I have more men than women, which is interesting to me, but good. The men feel great.
For pellets.
For pellets.
Yeah.
So I was a VP of a hospital for a while after I graduated with my doctorate in clinical psychology. And I was a master's prepared nurse, and I took a VP position at a hospital. I did it for about a year, and I realized this isn't me. I don't want to sit at a desk and go to meetings where nothing gets accomplished. I wanted to be back in patient care. I looked for something. I went to work in Beverly Hills with a doctor who did only bioidentical hormones. I did that for about a year, and then a job at Sansum came up, and I always wanted to come back to Santa Barbara because I had been living in Manhattan Beach for about 10 years and working at UCLA mostly till I went to Beverly Hills.
Yeah.
So the Beverly Hills job was really interesting. I got a nice clientele, but moved up to Sansum and worked for them for 6 months. Hated every minute.
Okay.
Because it was corporate medicine, and I don't work like that. So since I have my doctorate in psychology, I always look at people through that lens. I want to know, how are you emotionally? What's going on in your life? What stressors are you dealing with? Because those impact, I believe, they impact one's health. I think if you have too much stress for too long, it's not
Absolutely.
good. And then, of course, I get so I left Sansum. And then I went to work with a friend of mine at the Buellton Medical Clinic. And 2 weeks after I started there, she sold it.
Oh, my goodness.
I guess it had been for sale for a long time, but no one had been interested in it.
And what was that clinic?
Buellton Medical Clinic.
Okay.
It was a broad spectrum family practice.
Oh, okay.
Okay. So I didn't get to do what I like to do, which is the hormones and the anti-aging. And after she sold it, I just said, maybe it's time for me to open my own practice, because I had a following, and I'd been doing house calls and having people come and meet me in somebody else's office.
In San Ynez?
Yes.
Okay.
So anyway, I opened my practice 2 months ago. I do bioidentical hormones. I do IV hydration with vitamins.
And wait, it's called, give us the name.
It's called the Santa Ynez Medical Clinic.
Okay. And where is it?
It's on Segundo. It's right downtown, if you can call it downtown.
Right.
There are 10 buildings. It's
Yeah.
downtown.
Great. What was it before?
I was a dress shop.
Okay.
So I went in and did some construction. And
Yeah, I
turned
saw it on
into a
Instagram.
clinic.
It looks very pretty.
Thank
Yeah.
you. Yeah.
Good job.
Turned it into a clinic. We just placed our first ad in the Stroll magazine. I don't know if you know about Stroll. It's a new magazine local to the Santa Ynez Valley. So hopefully that ad will bring us some business. Right now, I have about 120 patients, but that's not a lot, really. Some days we'll get 5 or 8. Some days we'll get 2. So I'd like to see it ramp up so more people are aware that we're up there.
A patient calls up. They're calling you because they know that you're in the hormone business, and as you say, there are more males than females at the moment. But what is your course with them? What happens when they come into the office? What do you do? How do you manage it? How do you make decisions with it?
Always start with the science first. So I do labs. I look at their labs to see where they're at. again, I do global assessment. I want to know how they are, what is bothering them, do they have any symptoms, of course, all those things. Then when the labs come back, I'll call them to come back in. We sit down and talk about all the benefits of hormones, if they're low, of course, their cholesterol. I oftentimes put somebody on bergamot for high cholesterol. I'd rather go with a more holistic approach if I can before doing pharmaceuticals. So basically, they come in, and if they decide to do the hormones, they'll come back another day and we'll do it. Sometimes they'll do it the same day, depending on how busy. And then I check their labs at 6 weeks.
Yeah.
But most people, I've only had one person, and it's a man, and this guy puzzles me. And it's funny, he was one who didn't want to pay up front. He wanted to have a payment plan. And so we did his hormones. I did them for him. And it's now been 5 weeks. He says he has no benefit. I find that so hard to believe. So he's doing his labs next week, and we'll see.
Yeah.
But have you ever had that?
Like testosterone is a different, because that's presumably what you're giving to him. Do you remember roughly what his baseline was?
Yeah, it was 300.
Okay. And how old is he?
He's 58.
Okay, so average. I find that quite often they don't notice much until they get to really optimal levels, like 800 for somebody of that age, and we're watching other things along the way, just looking what the H&H, hemoglobin, hematocrit are doing what their estrogen is doing, and their PSA, and to see that there's no particular problem. So I think I've seen patients that haven't had much of a feeling of benefit from it, but I don't think it's all about that, because I think that if patients are doing it because they want to increase libido or they want to improve intercourse and erections, they sometimes won't notice anything. And so those take further additive parts to it. Where I found that people notice testosterone most is when they exercise.
Yes.
And
Absolutely.
that is a faster response and more of a response in terms of muscle mass and strength.
Sure.
And so I wouldn't worry about, I would convince him that, look, your levels have gone up. Okay.
Right.
If it has, we do occasionally see patients that just need more. You're usually doing pellets for testosterone?
Yes.
Okay. Do you ever do injectable intramuscular? Okay.
Yes, I do. And oftentimes I'll do a trial of IM shots
Yeah.
for 3 weeks in a row.
Yeah,
and
great.
if they have, to see if they have any benefit. If they
Right.
do, then we know the pellets are going to really help them, and we do that.
Yeah. Okay. So those are obviously two successful ways of treating them. But I would look at that. What I personally have found with testosterone is that it matters more to me. I feel a greater change in my exercise and the results from exercise
Sure.
than anything else.
Because you can build muscle instead of lose it with the testosterone.
Exactly.
Yes.
Yeah. So that's huge to me. But I think there is an optimal way. I really think at one point, and this is a number of years ago, I've given myself shots occasionally. I don't like doing that very much, so I use topical creams.
Sure.
And I found that I really didn't feel any different, even at a level of 1200.
Wow.
Okay, but I pulled it back from that because I didn't want to be that high. So I think that happens sometimes.
Okay.
If they're looking for libido or difference in erections, it's probably not going to happen, but it will happen in the gym. And so there are other things that we add into it. And we will talk about those other things that we can do.
That would be great.
Whether it's shockwave therapy or what's really come across my horizon recently is tadalafil, Cialis.
Oh, yes.
And for two reasons. Cialis, like Viagra, has a good benefit. There's benefit shown, and most people will respond, but they have side effects very frequently. Flushing, not feeling good, can have had a hangover afterwards. But if you use a low dose of Cialis, 5 daily,
yes,
it works so that they can be ready
anytime.
And it makes a very significant difference to their erection as well. But what was the really significant finding that I came across, or another physician had shown me, was an incredible difference in longevity and decreased heart attacks and just overall, and Alzheimer's decrease. A huge study with just using Cialis. Forget about it for an erection. Okay. You can get Cialis and say, no, I didn't need it for erection. But
Right.
I did it for my heart.
Yeah,
Okay?
I did it for my heart. That's a good one.
Because I think that ED is and I like to use this phrase, is the canary in the coal mine. It'd be the first sign that a guy gets of cardiovascular system is deteriorating. Pay attention. And exercise is the best thing for that too.
Okay.
But regular tadalafil, and it's really cheap. Now it's the generics.
So do you believe it works better than Viagra?
I don't know.
Okay.
I don't know. The reason why I started using and recommending tadalafil was because it was common knowledge that there was a once a day dose.
Yes.
That was easy to do. And I have one patient who just couldn't use any of it because either it was Viagra or tadalafil, and he just had such side effects from it that it wasn't worth it. It just was not worth him doing. And when he started taking a 5 milligram a day dose, it's great.
That's awesome.
So
really good.
Those are other things that there's always some wrinkle in the whole thing. There's something's missing from time to time.
I want to go back to what else you're doing in the practice, because sorry. And Duncan, your chair is rubbing against the table. If you could just be aware of that. There you go.
Thank you.
So you're doing pellets. Are you doing creams too?
I do, but not very often because I don't like the fact that they can rub off. I think especially young people with young children, you don't want them to rub the testosterone or estradiol off.
Okay.
I prefer the pellet because of the consistency, that it's an even blood level and you don't get all that variation that you do with the injections. So when I do a trial of injections, I'll give them 200 milligrams and a big shot. And then they get the peak, and then they get the trow and come back again for another one. But as long as it works for them, then I'm confident the pellet is going to work.
Yeah, absolutely.
Yeah.
So I'll do the pellet. And generally for men, I'll put in 6 pellets, so 1,200. Unless they're already at 500 or 600, then I won't do quite as many. Generally get a good result.
Yeah. Absolutely.
With that.
Great.
And people keep coming back for it.
Yeah.
So I think
good.
one of the things I ask is, like, for instance, this fellow who claims he doesn't have much benefit, do you have morning erections? That's one of the first signs, right, that it's going to work. And he said, sometimes. So I don't know. But so I do that. And then for women, I do give testosterone and estradiol. I start with a very conservative dose and gradually increase if they need it. The vaginal moisture issue and the belly fat. And of course, I tell people that if you have belly fat before menopause, you're not going to lose it with the hormones. You're going to have to do something else. I also do the GLP-1s to help people lose weight. I have quite a few of those right now, actually. Yeah. And I do Botox and fillers.
Oh, that's good. That's great.
Yeah.
And you do IV therapy, you said?
Yes, IV with vitamins. I use NAD, Plenish. I get them from Anazao. You're probably familiar.
Yeah.
And I saw in your clinic you had the NAD, what is it?
True Niagen?
Yes, True Niagen.
Yeah.
So I just got their NAD, which you're supposed to be able to infuse in a briefer period of time.
Which is nice.
Very nice, because otherwise they're sitting in your clinic for hours.
I know.
Right.
Yeah,
Really.
we did the NAD for a while in the office because one of our practitioners she loved doing IV therapy.
Okay.
But then she's now moved away. But so we want to start doing more of that. And
I can do those for you. That's easy.
that would be great. Yeah. So you just opened a couple months ago and you're doing some little bit of advertising.
Yes.
And I noticed, you don't have a website yet.
It's in the process of being made. It's by July 1st, it'll be up.
Okay, good. Because I looked for your website.
A lot of people ask me that. And I hope it's good because I paid the guy enough.
Oh, shoot. Okay.
I couldn't find anybody who could just help me do it. But my daughter did her own, and she did a great job, but she's back in Vermont.
Yeah.
Yes. So people come in all the time and ask if I'll treat their diabetes or treat their hypertension. And I have to tell them I'm not a walk-in clinic for family medicine.
Right.
I want to do more of the women's health, and I want to bring more women in, and I definitely want to do the vaginal rejuvenation.
Wow.
I'm very excited about offering those things.
It changed my practice.
I
10,
bet.
10 years ago.
I bet it did.
Yes.
Yeah.
It's phenomenal.
So we're in the process of, just so our listeners know, beginning a relationship with you, working together more. Turner is your
It's going to supervise me.
supervisor, and we're going to be moving some of the vaginal rejuvenation treatments to San Ynez Valley, so people can come in and get those by you.
Yes, that would be
And
great.
then you're going to be spending some time in our office too.
Yes.
So it's a great
Yeah, I'm really-
Collaboration.
Yes,
We,
great
we,
collaboration.
I think we've talked about this once or twice over the decades.
We have.
But it just,
the
it
timing
just seemed
wasn't
like the
right.
timing's right now. That's really good.
It's
Yeah.
good. Because we have lots of patients in the valley.
That's great.
Yeah.
That's really great.
The-
I know.
What else was I going to say about that? What are you? Although you're saying you're not treating diabetes or thyroid disease or anything like
I mean,
that, or
if-
cholesterol,
If they have
but what about routine gynecology?
Yes.
Okay.
Women's exams, pap
Right.
smears. Yes, absolutely.
Do you have an ultrasound?
I don't.
Okay.
But Duncan said I could do them in your office.
Are you familiar with vaginal ultrasound?
I'm familiar with it. I've never done it.
Okay.
Yeah.
There were a couple of thoughts from San Ynez that you've got an X-ray department up there, which may just be more convenient,
To
easy
send
because
people to.
to send
Okay.
people there,
Yeah.
or sending them down. It's not. It seems like Pueblo Radiology, which I think are involved with the San Ynez Cottage.
Yes.
They offer cash prices, and they really seem like they're opening to
Weekends, evenings.
yeah.
That's good.
They're making things more available to patients.
Nice because
So,
it's
and that's
good.
what we just want to look at I do a baseline ultrasound, looking at the endometrial thickness, and I do that with every annual exam as well, just to see what's
Good.
going on because they occasionally pick up something unusual. So I think that's all going to be positive.
Good.
So
Yeah.
What are your fees right now for a new hormone consult?
This is a good question because I'm questioning what I've done,
Mm-hmm.
how to possibly redo it.
change it.
I have right now a concierge practice.
Okay.
So for
People pay monthly.
they pay annually.
Oh, annually.
But what I've been doing with my previous patients is they come in and I'll do their pellets and just charge them what I was charging them. So for a female coming in without concierge, I charge $650. That includes me reviewing their labs, me talking to them, doing the consultation, and then the procedure itself. I'm not sure if I should continue that or do the concierge fee, which is $3,500 for the year, but it's all inclusive. You might be able to give me some tips on
And
that.
Yeah, we can talk about
is
that.
this,
That's-
this for a pellet patient only? Is this for hormones only?
Hormones and IVs and vitamin shots.
So they get the hormone replacement therapy,
They get
IV.
3 IVs
3 IV
with vitamins, and then they get any
Shots.
B12 shots. They
Okay.
can get those weekly if they want.
Right.
Yeah.
Is it just you in the office
Yes.
answering the phone too?
No, I have an MA, but
Oh, okay, yeah.
actually she's only there part-time right now. I'm debating whether or not to keep her longer hours. Right now she works Monday, Wednesday, Friday
Yeah.
till 2. And then I'm just there by myself. I don't have the volume yet to really need somebody full-time.
No, that makes sense. I think there's lots to talk about here.
Good.
That will be really beneficial. When you were in Beverly Hills and doing HRT there,
Yes.
was it largely pellets there as well, or
Yes.
Okay.
No creams,
Okay,
no patches,
okay,
all pellets.
And was it a BioT practice or was it a,
No, it was, they use Belmar,
okay.
but I've seen so many ads for the BioT. I know they
Oh, I
tried to
know.
get in everywhere.
Yeah.
yeah,
So I wanted to talk to you about a male patient that I have who has Parkinson's. And I know that testosterone can actually retard the progression of Parkinson's. It helps with proprioception. It helps with their ambulation. So I had this patient. He was barely functioning. He had a lot of brain fog. He wasn't able to get up very easily. His gait was really unsteady. His testosterone was only 200. So we gave him pellets. And the remarkable difference. Yeah. He's walking like a normal person.
Wow. He's
thinking clearly. He's just doing great. He comes into the clinic every week to show me how great he's doing.
That's nice.
But I was a little hesitant to do it. I know that testosterone can help retard the progression, but I had never had a Parkinson patient before.
I think testosterone is a really pretty safe hormone to use. I'm very comfortable with that.
Okay.
I think that, again, we're struggling against the status quo.
Yes.
And it's hard to change things. And BioT did us all a great service. They were concentrating on testosterone for women of any age. And I have a very good friend who's another OBGYN in the Bay Area who started doing the hormones with BioT and stayed with them. And they had approached me like probably 15 years ago. And I was already doing it. I wasn't doing a lot of them. And frankly, the only reason why I started doing pellets was because patients were asking for it. Uh-huh. Other patients were moving to town, and could I do it? Right. Yeah.
Let me look it up.
Wasn't quite like that, but almost. Right. But I didn't like the idea of the involvement of BioT in terms of all of some of the restrictions, because if you want to still be on their list, which is great for marketing, I'm sure, you couldn't use Belmar. And so they were taking a lot of the profit out of the business. Sure. And they were charging a lot to teach people how to put in pellets, which wasn't really too difficult. And so that's how I never got involved with them. And this friend of mine is very much involved with them at this point. And he was thinking, I really should be doing better with this. I'm giving a lot to BioT, but then he was getting so many referrals from them that the advertising was worthwhile.
Okay.
But it was really more of an issue. My concern was more that they were training people who really weren't qualified to use HRT.
That's what I have a problem with.
So,
that is a problem. Because people, if they don't understand the anatomy and physiology and the science behind why we do this, and they don't have the education.
And if they're not coming from a GYN place and they just start doing pellets, who's checking on everything else? How do you make sure that testing is being done? Because what's happening is med spas are just adding that in what they're doing now.
That's crazy.
And you have
because there are RNs running most of the med spas.
And then you don't have a background in health, making sure all those boxes are being checked before you put someone on hormones.
I think this is really your practice extending to Santa Barbara, and Santa Barbara's medical health extending to the Valley.
The Valley.
So I think this is a win-win because it's you, me, and the patients.
That would be great.
That'll be good. Thanks very much for coming in
welcome.
today, and our conversation will continue.
Okay. Yeah. Nice to see you, Duncan. Thank you.
Pleasure. Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.